Hi everyone, I'm here with one of my closest friends in the whole world, the lovely Maria Fowler. Good to see you. She's here on Mother's Day with her mother Trudy. And we thought that we'd take you through a little bit about how the aging process works. It's because I was in a restaurant in Mayfair with these two a few months ago and they started picking my brains, and it gave us the idea that we'd actually explain it on video for you, because it's quite interesting to have daughter and mother and explain a little bit about, about aging and what we can do about it. So, we're going to start a little bit at the top, and if we look at Maria here, we're going to start in the forehead area, because that's, you know, a nice place to start. And if we have a look at Maria here, and if we have a look at Trudy, you can see a little bit that as time goes by, I don't know if you can pick it up on the camera or not, but there's some horizontal lines that creep in. Now Trudy actually doesn't have those really badly. Sometimes people will have really bad horizontal lines. Just raise your eyebrows for me and relax. And she doesn't have them really deeply, but what you're seeing a much bigger problem with is some of these lines in what we call the glabellar complex here, which is the frown area. So you've got these vertical ones, 11s or maybe even 111, and you've got this horizontal one here as well, or a couple of these. So that's what you're seeing even at rest when she's not making any facial expressions. Those are some of the main areas that always get treated. But the other thing that we look at a little bit, which is a bit more subtle, is if you have a look at Maria here, you can see that there's a little bit of convexity of the forehead. Yeah. So it just, that means that it just kind of bulges outwards a little bit, which is attractive, which is the way that we start off. And as time goes by, actually, you get a bit of bone resorption. In other words, the bone and the other structures over it, like the subcutaneous fat and muscle, everything gets a little bit thinner, and so you see that the forehead flattens out a little bit. It doesn't have that nice 10 to 15 degrees of outward convexity anymore, and sometimes we can fix that as well. So then we look at the brows. The brows get a little bit heavy as time goes by, and you can see sometimes that you can see a little bit of this heaviness around the eyelid area. This is really tricky, and that's why you have to be very expert when you're using any treatments around the forehead area, because you never ever want to make that heaviness any worse, because that's pretty dreadful. You can see over the eyelid area here, if we were to weaken the elevating muscles here too much with some Botox, you'd get this kind of effect, which gives a very heavy area just over the eyelid. So it's important to be very careful if you have this kind of problem. And then we're going to take a look at some of these lines around here. If I just get Trudy to smile a little bit, and you can see some of these crow's feet here. Maria, why don't you smile for me? So not so much getting some of that. So that's something that gets deeper as the skin thins as time goes by in that area around the eye. So that's easily treated as well. I actually like to treat that with Botox and maybe some dermal fillers as well, because there is some volume loss in the skin that's happening which needs to be addressed. So it's important to understand, though, I'm just going to step away from that for a second and just explain that it's important to understand that with the aging process, it isn't just a case of the skin. Skin quality can decrease, the skin gets a little thinner, and gets a little more dull and dry as well as time goes by. So that's one of the things, the skin. The second thing is the actual muscle that you have, and that gives you these active lines that sometimes then become present even at rest, and that's where Botox is really useful. And then you get actual loss of the subcutaneous fat compartments that exist all over the face, and that gives you a little bit of thinning and loss of volume, and that's where fillers are really useful. And then the thing that people don't think about so much is the bone as well. The bone actually resorbs, the bone actually becomes less strong and less thick, and we can see that on x-rays. So what that does is some of what we were talking about here in the forehead, but also it means that if you have a look at the orbit, which is the eye socket here, Maria's is actually quite nice and small, but as time goes by, that orbit, the eye socket, starts widening, yeah, because of some of bone loss that happens, and you can see that where the actual eye socket starts looking larger and a bit more hollow, and that can be treated sometimes with something called a tear trough correction. I don't think we're going to do that today because I don't want to leave Trudy too bruised, and that procedure really can give you a little bit of a black eye type of appearance, but that's something where filler is deposited into these areas to give it a bit of a plumping effect, and maybe you'll have to do a video about that some other time. So moving down, let's take a look at the cheek area. So this is a really great thing. Let's try and capture this. Marie, can you just tilt over to that side a little bit? And if we can see some of this cheek volume here, which there's a lot of. There's no dermal fillers in Maria's face here. She does get asked if there are. Actually, this is all completely natural cheek fat that she has, and it's one of the signs of youthfulness. It's one of the attractive things in a youthful face. And if you have a look, over time, we've lost some of that. So some of that cheek fat that was here is no longer present. Some of it has really faded away. And then you've also found that the bone here of the cheek is probably less prominent than it used to be. So that's why people, when they have quite prominent cheeks, like you might have done at Maria's age, now is looking a little bit flatter in comparison. Okay, I'm going to get you to look straight forward ahead again. The other thing is that all of this cheek volume, it sits quite nicely, doesn't it? But as time goes by, it tends to descend here, and it tends to go in two directions. It goes downwards, and it goes inwards. And that's where some of these nose to mouth lines or nasolabial folds develop, okay? Because this cheek fat that was sitting up here quite nicely before now goes down and in, and that's what you're seeing right here. You're seeing the development of these nasolabial folds because of that movement. So because we know the aging process, we know which way different areas are going to go. And it's quite useful for us to have that knowledge because it helps us then rectify it. Okay, so next thing I'm going to talk about is a little bit about the overall shape of the face. So if you have a look at Maria here, you've got quite a heart shape, haven't you? You're quite prominent here in the cheek area, and then it tapers down nicely to the chin. So that's that ideal shape that we have. And it's like an inverted triangle, if you imagine. That's the top, and down like that kind of triangular shape. Or you can imagine it as a heart, which is also a very similar shape. And then as time goes by, everything gets a little bit more square. It gets a little bit more boxed off. And that happens with some of the descent of these tissues that you can see that have moved downwards as well in the jowl area, and then giving rise to this line here, these marionette lines, so-called. Trudy calls them Marie Antoinette lines sometimes, which is another nice name for them, but they're actually marionette lines. So that gives you this kind of an appearance here, which is where some of these tissues are just pushing forwards against the ligaments here, which are keeping them from really spreading out. So it's a little bit complicated, I won't get too technical about it, but essentially you get this kind of a double bubble type of effect here. So it's nice to try and straighten that out. There's limits to what you can actually achieve there. And the next thing I'm going to talk about a little bit is this downturned corners of the mouth. You can see that I explained a lot of these aspects in that other video with Nicola, but what you can see is that it is pulling down a little bit. Let's look at Maria, very sort of kind of going upwards at this corner of the mouth. Can you see that on the camera? It's going up or staying quite horizontal, and if you have a look at what Trudy's got here, it's at the corner is a little bit downturned, and then that goes into this other crease that we're talking about. So it's a nice idea to try and pull that up as well with a combination of a couple of injections to release the muscle that pulls down, and also to really just push up with some filler at the sides here. Next thing I'm going to talk about is some of the ratios that exist here between the lip and the chin area. So let's take a look at Maria. What you can see is that you've got quite a short ratio here. When you think about the distance, the total distance from the nose to the bottom of the chin, about a third of that is up here between the nose and the top lip, and then about 2/3 is here. So in other words, a short distance between nose and top lip, and then quite a longer distance between the lower lip and the bottom of the chin. If we have a look at what's happened here with Trudy, is that it's become a little bit more equal in that you're getting a bit more of an elongation of this part from the nose to the top lip. It's a lot longer, and you've got a lot more white lip showing, and part of the reason for that is that you've lost volume here in the top lip. So you can see that it's sitting a little bit flatly, and it's inverted a little bit and rotated inwards on itself, so the red part isn't showing as well. So we often like to then bring it outwards a little bit, so reverse that. And another thing that I'm seeing here is, let's just compare the chins a little bit. And so, have a look at Maria's chin, really nice and smooth, okay? And Trudy didn't really like this, but this golf ball appearance is what I called it. Just to, always try to think what I should call it. And it's that puckered up quality, and I hope you can pick up on that, yeah? So you've got a smooth texture and contour of the chin here on the surface, and over here you can see a little bit of a dotted golf ball type of an appearance, and that's something we can fix with a couple of doses of Botox very easily. And then just carrying on talking about the chin a little bit, you can also see in Maria's case that the chin is coming down to a little bit of a nice heart-shaped point here. It's coming down to a nice point right at the bottom, whereas here in Trudy's case it's kind of coming down and then flattening off in a horizontal way. And so we sometimes like to just bring that out so that it comes to a little bit more of a point, which I don't know if that cotton bed helps you show, but it looks a lot more attractive to my eye than that really horizontal look here. So the next thing I'm going to talk about a little bit is to do with the jawline. And if you have a look at Maria here, if you look at the top of the cheek and how it tapers down to the chin, it's actually contouring nicely and smoothly and tapering in. Whereas if you have a look, you're starting to get in Trudy's example a little bit of a boxed off appearance where it comes down and becomes a little bit square, and that's very common, and that's something that I address with some of the injections in the jawline, just to slim it down a little bit, narrow it, and get a little bit more of this nice natural contour rather than a bit of a square boxed off type of look. And I think that more or less covers the basic aging process that we're looking at here. There's a lot more to it, but I think that those are the main points. So let's get you guys to step off, and then we'll see what we can do about that.